The latest to join the lockdown club. Liverpool City region, Warrington, Hartlepool and Middlesbrough. From 1 minute past midnight on Saturday, all of them facing enhanced restrictions. The Health and Social Care Secretary updated the Commons this morning, part of the new Look More consultative government.
In parts of Teesside and the northwest of England, cases continue to rise fast. In Liverpool, the number of cases are 268 per 100,000 population. So together we need to act.
There will be regulations to prevent social mixing, except in outdoor public spaces, recommendations not to attend sporting events, care home visits only in exceptional circumstances, and guidance against all but essential travel, except going to work or school. That bringing it more into line with restrictions across the border in Wales, where an hour ago 4 local authorities in the north were also locked down. Despite government efforts to brief MPs and community leaders in advance, there was open rebellion from Middlesbrough's mayor and questions demanded from Liverpool. You're asking for what the science is behind it, and has there been any response to that?
Well, no, there wasn't, and we met with the Minister today, and we're going to have further meetings, because that will give comfort to people in the Liverpool City region that this isn't just a finger in the air type approach, and that there is some sophisticated methodology behind it.
By this Saturday, just under a third of the UK will be subject to extra controls, and some areas have now been locked down for weeks.
I think we need a rapid review of the local lockdowns, because what we're seeing is that in some areas in lockdown, the infection rates are going up, not down. Well, that's worrying, and there needs to be a review into that. In other areas, they've been in local lockdown for months. And so there needs to be a rapid review. What's working, what isn't working, what does the science tell us about that? But people need to know what's the exit strategy from this. And whilst we're in lockdown, we need a support package for the businesses and individuals who are not able to work.
The government is not only walking a fine line between health and wealth, that is saving lives and saving the economy, they're also very conscious that people are becoming fatigued. It's 9 months now since this pandemic started, and people are getting sick of it. They want it to be over, and yet there is no sign of that happening at all. There was, however, the tiniest glimmer of something positive today. The REACT Community Prevalence Study from Imperial College showing the rate of infection may be slowing. 1 in 200 people in England are now estimated to be infected, although in the northwest it's 1 in 100. But the doubling time has reduced to about 10 days. It was every 7 to 8 days. And the R number, the reproduction rate, could also be slowing. They estimate it could now be just above 1.
The thing that we see in the data is we see evidence that on average people's behavior has changed. The way that we're making social contacts has probably changed a little bit for the better. And the timing that we've observed that, it is certainly consistent with the rule of 6 making a difference. But the important point is that we have to, to make prevalence go down again, we have to get sustained changes in the way that we're doing our social mixing. Otherwise, it will start to go back up.
In the range of measures to combat the virus, there is also the NHS test and trace system, and it is still facing problems. Today's figures show 3 in 10 people testing positive could not be contacted. Although we were told today 14 million people in England have now downloaded the NHS COVID-19 app.
Well, in Northern Ireland, pubs and restaurants in Strabane and Londonderry will be restricted to providing takeaways, deliveries or outdoor dining, while people are to be encouraged to work from home. First Minister Arlene Foster acknowledged the news would be a blow to business in the North West. Back in Liverpool, how is news of the new restrictions going down? Our North of England correspondent Claire Fallon is there now. Claire.
Well, it's another day and another new set of rules for some parts of the country to try and slow the spread of COVID-19. And by this weekend, about 2/3 of people who live in the north of England will have some kind of extra measures imposed on them. But as we now know, not all local lockdowns are created equal. So I think the simplest way to describe the restrictions that will come in here is to say that the rule of 6 will not apply if you are indoors. So if you're going to the pub, you have to go with someone who you live with. And when the pubs kick out at 10 o'clock at night, to go back to someone's house to carry on drinking, then it needs to be your house and you need to carry on drinking with the people who you live with. Bubbles are the exemption to all of that. I think there's been some dispute today as to whether these rules don't go far enough and won't be effective, or whether they will just be too great an imposition on people's lives and also on businesses here. And earlier today, as Matt Hancock made his announcement in the Commons, we were at the Art School restaurant in Liverpool to get reaction from the owner.
We've heard a number of different potential permutations, should we say. Oh, here he is. If you're going to do this, you have to compensate business.
What are your thoughts, having heard what you will now have to do?
In some ways, I'm slightly relieved, because I felt that the sanctions could have been a lot stronger this morning. I have some colleagues in the northeast that I've been comparing notes with, and they've obviously experienced it over the last week or two. And it has changed their business. You know, people are reluctant to come out in groups, and they are reluctant because now you can't. You know, you can only come in a 2 or a 4 as a family.
Will that have likely been someone cancelling a booking on the phone then?
It could have been, yeah. I mean, we are experiencing, you know, some customer confidence sliding already.
Is there a reality that even though you're not being closed down, the margins become so tight that places just won't survive?
We have to have the support package that matches the sanctions. Otherwise, you will see not just the levelling up that they talked about when they came into power, but you'll see the decimation of the north.
Well, that comment does tally with something he's been saying in recent days, when he's warned that unless there's financial support for areas with more restrictions, then frankly this amounts to levelling down rather than levelling up. As for whether the local lockdowns work, I keep hearing politicians saying that they have the data to show that they slow the spread of the virus. It's not quite so clear to me when I look at the data. Take Manchester, for example. Local lockdown restrictions in place for 2 months now. And right now, the infection rate is 7 times higher than it was then.
Claire, thanks very much. Well, earlier I spoke to Dr. Janelle de Gruchy, Thameside Council Director of Public Health and President of the Association of Directors of Public Health. I started by asking for evidence that these local lockdowns are working.
In Greater Manchester, we are seeing this real rise, but we have had restrictions in place. Now, that could be telling us that the restrictions are providing some kind of break on the rise, because you are seeing other places in the north that didn't have any restrictions, and they have, in recent weeks, seen a very dramatic rise. So I do think there's some evidence that certainly the restrictions are having some kind of braking effect on the rise in the rate, but I don't think it's sufficient.
Well, where's the public health evidence for a 10 p.m. curfew in pubs and restaurants?
The evidence base for what kinds of restrictions we need to put in place is still emerging. There's no doubt about that. And also the kinds of unintended consequences of different restrictions. What we know is that we've got to reduce the amount of people we come into contact with. What the problem is, I think, is that they're not simple enough, communicated simply, and people are getting confused. So what we need from national government is a real simple steer on what kind of measures are going to be in place for the next while. We need, as it were, a winter plan.
Does it go back to Dominic Cummings breaking the rules? You've got the Prime Minister's father not wearing a mask in the shop. You've got the former leader of the opposition breaching the rule of 6. When the people in authority, when MPs themselves are not following the rules, how damaging is that from a public health perspective?
I think what I would say, Cathy, is that we all need to get behind those rules. For some people, it's reasonably easy to follow the rules. You know, if you've got a job that you can work from home, you're still going to get your salary. What we need is when these new, if new restrictions come in, they need to be accompanied by some kind of funding package, either for individuals or for local authorities who are having to support our communities in these really difficult times.
Are you making that request for funding direct to central government? Are you getting a positive response?
We are making that request in many ways. But if I can just point out, for instance, we know that NHS Test and Trace has had £10 billion of funding. We are seeing a fraction of that. And yet my team is having to pick up a lot of contact tracing. We're doing a lot of the communicating and engaging with communities, helping them with the confusing messages. We're doing a lot of, well, we are doing the enforcement locally, and we're supporting communities who are struggling. And yet we're just seeing a fraction of what we've seen go into, for instance, the 10 billion going into NHS Test and Trace. So we're having to keep our community safe on a shoestring. We're wanting a similar package for local government, for local public health teams to enable our communities to continue to be safe from this awful disease.
You're clearly frustrated when you look at the test and trace figures that, they're still not anywhere near reaching the 80% of close contacts, tracing 80% of the close contacts of those tested positive. That's what the Prime Minister said needed to be reached. It's not happening. How frustrating is that for you, and what is going wrong there?
It's immensely frustrating, and not just to me, but to all the directors of public health who are having to now try and work with a national system that's just not working for our local communities in the way that we were led to believe. Kathy, we've been saying this right from the start, that it does need to be locally led contact tracing, and we've always been willing to help and support a locally led, local by default contact tracing or test and trace program. But unfortunately, it's just not happening quickly enough for us and for our communities.
Dr. Janelle Degruschi, thanks very much.
Thanks.
Now, SNP MP Margaret Ferrier has been suspended after travelling on public transport after testing positive for coronavirus. The MP for Rutherglen and Hamilton West apologised after travelling to London to debate the coronavirus response in Parliament after experiencing COVID-19 symptoms and while waiting for a test result. She then found out she was positive with the virus, yet returned to Scotland by train. She said, "This was wrong and I'm very sorry for my mistake." Well, our political correspondent Liz Bates is in Westminster now. Liz, quite an error, this.
Yes, and quite a journey. As you say, this is Margaret Ferrier. So she is an SNP MP for the Scottish constituency of Rutherglen and Hamilton West. So last week she was experiencing COVID symptoms. She had a test, as you are expected to do. While she was awaiting those test results, though, she made a 400-mile journey to come down to Parliament. She then did test positive, and then on Tuesday, after that positive test, made the return journey back to her constituency. So a very clear breach of the rules as laid out. She did say in a statement today that she has informed police and that she deeply regrets her actions. But of course now there are many questions around what happens next. First of all, will her party take any disciplinary action? Will she be punished in terms of fines, as you can be if you breach the rules? And of course, who has she been mixing with? There could be potentially many, many people in Westminster and people that she mixed with on her journey on the way down that could now be at risk of COVID. So many questions still unanswered this evening.
Liz, thanks very much.
We asked for the Department of Health for an interview today, but no one was available. I'm joined now by Angela Eagle, Labour MP for the Merseyside seat of Wallasey, which is about to go under the new restrictions. And what effect is that going to have on your constituency? Could you just give us a very quick sense of what its sort of profile is economically?
Well, we rely very much on the leisure and hospitality industry in the whole of the city region, and Wallasey, my constituency, is no exception. It's 57,000 jobs. It's 20% of our economy. There are an awful lot of small businesses and people who offer services in the hospitality and leisure industry who are just being treated in this way, told that they've got to restrict the way they do business, close early, have much lower footfall, so they can't even break even. And yet today, astonishingly, the government said that there was a mere £7 million for 9 local authorities, including the 5 in the city region, that have been put under these restrictions. You can't have lockdown on the cheap. The government really must step up and say, okay, we've got to have extra restrictions. We've got to get the virus down. We're in a dangerous situation. But what we must also do is support those people who either lose their jobs or their businesses because of the restrictions the government is imposing. It's simply not fair to expect local lockdowns to be paid for locally.
Right. Now, when we look at the other constituencies that have been locked down today, the other cities, I mean, we have Liverpool, Warrington, Middlesbrough, Hartlepool. What does that tell you? Those are areas of acute inequality. Is this virus really, in the end, attacking the poorest sectors of the community who are living in the tightest accommodation?
Well, certainly there is a pattern. If I look at the pattern of infection in my own constituency, and if I look on the Wirral Peninsula itself, the poorer eastern side of the peninsula has higher rates of infection. And this is partially because people tend to be key workers there and they can't stay at home or work from home. They're living in smaller spaces. They can't avoid meeting people in the way that people who might be more prosperous can. And so there is a direct connection there. And of course, if they lose their jobs or if they think they may need to self-isolate, they really can't afford not to be earning money. So yes, the government need to take account of that as well.
Could I just ask you what you make of the idea of an MP coming all the way from Scotland? She has now been suspended by her party, the SNP, but having had a test suspecting that she might have coronavirus, then coming on a train 400 miles, giving a speech in the Commons and returning by train 400 miles. What's your sense of this?
I have to say I'm astonished at the news tonight about Margaret Ferrier's behaviour. I don't know what she could have been thinking. She's exposed an awful lot of people to the threat of catching the coronavirus that she had. It's almost as bad as Dominic Cummings.